Welcome everybody to our educational webinar with Athlete Soul. My name is Miriam Glaze. I'm the founder of Athlete Soul. Thank you for joining us and watching this video with Thomas Hinton. He's a sleep and performance coach. He works with athletes and helps them with their sleep in order for them to have improved or better performance. He's going to introduce himself in a minute. Just wanted to touch base on the fact that you can find this recording on our website, as well as other recordings for transition from sport as well as wellness in sport. So you can go on our website at athletesoul.space/events and you'll find all of these resources. Now we're going to get started straight away. Thomas is going to introduce himself and then go straight into the presentation, and then at the end we'll take a few Q&As. So Thomas, all yours now. Thank you.
Oh, no, thank you, Miriam. I appreciate this. So again, like she said, I'm Thomas Hinton. I'm a certified health coach and sleep and performance coach. I'm also the CEO of Circadian Health Systems, LLC. And really, it's more of a consultancy. So I work with athletes, mental health and obstetrics. And I really just, help them get a better understanding of how sleep affects their overall personal mental and personal performance. With athletes, of course, how it affects their athletic performance. So I'm going to go ahead and go right into it. And again, Miriam, I appreciate you allowing me to come and present and talk about something that I not only have a professional but a personal relationship with, and that is with sleep. And as you can see, I have the main screen. I have the brain with the Z's on there because we'll kind of go into that a little bit too, the neurological side. So. First thing, the question that I always get that people want to talk with me about is the evolution of sleep. How did it start? Where did it come from? Especially with the fact that, some people go back to the days of the caveman, where, why do our bodies go into this dormant state that leaves us vulnerable to attack? Now, at this point, obviously, technology is advanced. Now we can live on a third floor of an apartment. Now we're not in danger of getting attacked by a saber-toothed tiger or anything like that. But it's pretty interesting as you go through the history of sleep, just how we've gotten to the point now, where there's requirements now for how many hours a certain age group requires and needs. So it's pretty interesting when you actually look at the evolution. When you go down that rabbit hole where it takes you. So the second part is, so what is sleep? That's also a question that I get. And the way I explain to people, sleep is one of the most important functions of the body that we as a society take the most for granted. It's crazy because sleep is so much, viewed as an indulgence or convenience, or even a weakness sometimes, when really it's a reward. Or not a reward, it's a requirement. And it's a state of muscle relaxation and reduced perception of environmental stimuli. So when you're sleeping, some of the things that are happening around you, you are not aware of. All right, and that's the whole point. And also, it's said that a third of our lives is spent sleeping. And for some people that have insomnia, it's a quarter of that. Right. Another really cool statistic is that I think it's said by the age of 3 or 4 years old, you'd have spent more time sleeping than you have awake, which I think is pretty neat. But sleep is also the time that your body and your brain, takes to relax and to replenish nutrients and oxygen that was used throughout the day. It's the time that it takes to regenerate, brain cells and muscle tissues and fibers and to recover and repair those things. And so it's really, really important that we take time to prioritize our sleep and actually teach our bodies how to do it. And for some people, it's easy. I can just lay down and just, close my eyes and go to sleep. Well, not everybody can do that. So that's why it's important to learn how to condition your environment on getting a good night's rest. So why is sleep important? It is essential for maintaining optimal physical health, mental and emotional functioning, and cognitive performance. So as we know, when we get better sleep, when we sleep more, we're able to remember things. Our brains are more clear. We're more focused. And of course, inadequate sleep time and poor quality sleep interferes with quality of life and is hazardous to your health. And that's really important. And a lot of people don't realize, just how detrimental to your health, sleep deprivation alone is. Of course, there's other sleep disorders called sleep apnea when you stop breathing in your sleep. That's pretty common. It's very hazardous to your health. It increases blood pressure. Any comorbidities that you have, and for those that don't know what a comorbidity is, it's a disease. There are two diseases that exist in the body at the same time, whether they're associated or not. And sleep deprivation, sleep apnea, it exacerbates those things. And so a lot of times people, have these, medical or health issues, and they don't know where they're coming from, or they don't know why they're as severe as they are. And they receive treatment, and their body is what's called they're treatment resistant, and they don't understand why. There's an underlying cause for that, and a lot of times it gets missed. So sleep is really important. I don't want to go off on a tangent about sleep apnea because I can go on forever. So I'll go on to the next thing. So for those of you who don't know, this is Edith Piaf. She was a famous French actress and singer and songwriter. And this kind of goes to some people's views about sleep. So she says here that for me, sleep is a waste of time. I'm afraid of sleep. It is a form of death. And then there's a lot of people out there that really have ill feelings about sleep. And if you look at certain religions, scriptures in certain religions, or various religions, sleep is kind of an allegory or equated to death. Because if you think about it, when you go to sleep, you wake up, and then there's the next day. So it's almost like you were dead, but of course you're not. But with Edith, she died at the age of 47 from drug abuse and insomnia. So that just kind of gives you a picture of what sleep deprivation will do to you, in terms of breaking the breakdown of your body when you don't get enough of it. And so this here is a diagram of what sleep deprivation and what sleep apnea can cause inside the body. First thing is depression. When you're not sleep deprived, it can throw you in bouts of depression, and anxiety. And the thing about depression and anxiety is that it can cause insomnia, and then insomnia can cause depression and anxiety. So they're considered biconditional. One can give rise to the other. Okay, a weakened immune system. That's really important because when we sleep, that is when our body ramps up our immune system, our infection-fighting proteins called cytokines. All right, so it's really important that we get a good night's sleep to either prevent infection or to just to minimize the severity of symptoms of when we get sick. And we're seeing a lot of that now with this whole COVID thing, going on. It's really, really important to get a good night's sleep to prevent infection or to minimize the severity of symptoms. High blood pressure. Sleep deprivation and sleep apnea can cause high blood pressure. A lot of times, just in my experience in the clinic and working with patients and clients, I'm noticing that a lot of them are, they're diagnosed with high blood pressure, what's called hypertension, and they're just put on a pill, and I'm a root cause person, so I like to know what's causing the high blood pressure. So we have to investigate more and go deeper into why. And a lot of times it's because of sleep deprivation and or obstructive sleep apnea, which kind of is a form of sleep deprivation because it deprives you of good quality sleep. So high blood pressure is a huge indicator for me when I'm talking with people and seeing patients, seeing clients. I want to know why they're having that, and so I investigate a little deeper. Heart problems, cardiovascular disease, sleep deprivation and sleep apnea one of the known causes of heart attacks and stroke. So it's really, really important that you get a good night's sleep to decrease those different diseases. Low blood oxygen levels, especially when you have sleep apnea. When you stop breathing at night, there's no blood flow. So therefore, there's no oxygen moving to the muscles, to the heart, and to the brain, which is really, really, really important. So I'll go into some other things here. So now we're going to talk about how it impacts athletes, because that is the majority of the population that I work with is athletes, and just trying to get them to understand the impacts that sleep has on their overall mental and physical performance and their overall health, right? So for athletes, especially when it comes to exercise, so exercise depletes energy, fluids, and breaks down muscles, okay? So hydrating and refueling your body is a huge part of the recovery process, right? And so if you see here, what you do before and after competition really impacts how your bodies rebuild and repair muscles and replenish nutrients. And really what I should say is how you sleep before and after competition. It really matters and impacts how it does these things. So sleep, it impacts reaction times, motor function, motivation, focus, stress regulation, and muscle recovery. I'm going to focus on stress regulation here because when we're stressed, our bodies release a hormone or a chemical called cortisol. That's the stress hormone, right? And so when I talk to athletes and I learn, what their sleep environment is like, what their work environment is like, what their if they're taking care of finances or doing anything stressful in the bedroom, I usually I don't recommend that, because when you want your body to only associate that environment with sleep, with a place of relaxation. And so when you're doing stressful things in the bedroom, your body will only start to associate that environment with stress. So therefore, when you enter that environment, your body kind of does one of these things. Oh, well, the last few times you were in here, you were stressed. So let me help you get ready for that stress, right? And so then it starts to release those chemicals to help you get ready for it when you're trying to go to bed and go to sleep. And it makes it very, very difficult to do that, to achieve that. Muscle recovery. So that's another big one there. So a lot of athletes, especially I've noticed more on the high school and collegiate level, and there are some professionals, that I've talked to, that didn't really understand this. But when you're working out, lifting weights, when you're practicing, when you're actually competing, you're breaking down muscles. You're causing trauma to those muscle tissues and fibers, and it doesn't like that when you do that. Okay. And so the only time that those muscle tissues and fibers actually have time to recover and to repair themselves is during sleep. And that's where growth hormone comes in. Okay, so when we sleep, there are certain stages of sleep where growth hormone is released, and that is actually what helps us, helps our muscle tissues and fibers fuse back together and repair themselves. Memory and learning. There are certain stages of sleep, and we'll get into this later on in the presentation. There are certain stages of sleep that allow you to access, your recall. As you're working out, as you're training, certain different movements that you're learning. When we sleep, our brain goes through this process where it starts consolidating short-term and long-term memory. Okay, and so it kind of knows, even when we're sleeping, even though we're not necessarily involved in that process, but like we would be during, in our wake life, it knows what to do with these bits of information. It knows where to put certain things, what's needed, what's not needed. Okay, and so when we're learning new movements, when we're training, doing speed training, whatever we're doing, it takes what we've learned and it kind of puts it off in this little memory bank. So the next day, when you start doing those things again, you can recall that, and it makes it easier for you to perform those movements. Really cool how that works. Unwanted weight gain, that's big. When we're not getting enough sleep, there are two chemicals, hormones that regulate what we eat, how we eat, and when we eat it. Okay, it's called leptin and ghrelin. So leptin is the hormone that tells us that we're full, it's time to stop eating. Ghrelin is the hormone that tells us that we're hungry and we need to eat. Well, unfortunately, when we are sleep deprived, or if we have obstructive sleep apnea, the hormone leptin is suppressed and the hormone ghrelin is increased. So now we're craving fattier, higher calorie foods. Okay, and so now our body's craving these things, and so now we're eating them, and then we're gaining weight, unwanted weight, and we don't know where it's coming from or why. And it's all based on what we're eating, when we're eating it, and then how we're eating it. And that's really, really important that we understand that. And so this is a diagram of the different stages of sleep and what happens in each stage. So of course, stage one is the light stage. That is the transitional stage of sleep out of wake. It's a very light stage. You can be waking up really easy. So I have clients that I deal with now who are really light sleepers, and really anything wakes them up. So really, they're learning how to teach their body how to transition into that deeper stage. So of course, there's stage two, which is one of the deeper stages of sleep. The muscles relax. your body temperature drops, heart rate slows, and your breathing rate slows. Okay. And then, of course, there's stage 3, and back to stage 2. So stage 2 is since that's the second stage, deeper stage of sleep, it's a lot harder to wake somebody up out of stage 2. And if you do, you'll notice that they're a little groggy, maybe a little irritable, maybe a little upset that you woke them up. So I definitely would not wake anybody. Not that you would know that they're in stage 2 sleep, but if you notice they're in a deep sleep, would not recommend waking them up. So of course, stage 3 is one of the deeper stages, another deep stage of sleep. Blood pressure decreases, blood flow to the muscles increase, and then this is where the growth hormone is released. It's during stage 3 sleep. All right, so it repairs the muscles and bones and the internal systems. And I kind of want to go off topic here a little bit. So as it pertains to children, for example, this is why sleep is really, really important for the mental and physical development of children. Because children spend the most time, stage 3 of sleep is the stage that children spend the most time in, right? So therefore, it's really, really important because that is where, again, the growth hormone is released. So 75% or more of growth hormone is released during stage 3 sleep. And that's why I work with the obstetric population, so parents can understand, get a better understanding as to why it's really important for their child to be on a good sleep schedule, is because of that. And then, of course, stage 4 is REM sleep, which is REM stands for rapid eye movement. That is when you dream. So when we dream, our muscles are paralyzed. At least they're supposed to be. All right. There's a few hormones and chemicals that mix together that are able to do that. So it's kind of scary that we have chemicals or hormones in our body that can paralyze us in our sleep. But if we don't do that, we'll suffer what's called RBD, which stands for REM behavior disorder, which means we act out our dreams in our sleep. Which can be harmful to either ourselves or our bed partners if we have one. New memories and information is processed. And that kind of goes back to the other slide where I talked about how the brain actually consolidates short-term and long-term memory. So getting REM sleep is really, really important. Our body is transitioned through 4 to 5 REM cycles a night, each one lasting longer than the one before. And it's easier to wake up out of REM than it is any of these other stages of sleep. Waking up out of REM, you feel more relaxed. You're not as groggy. You're not as irritable. Okay. And so right here, this is an example. This is a diagram of muscle fiber tears. So if you see the arrows here, these are where the muscle fibers. I'm pointing like you can see this, but this is where the muscle fibers have been torn. And so this is where, when I'm talking to my clients that are athletes, one of the things I try to get them to understand is that you use and abuse your bodies more than the average person or non-athlete. Therefore, our bodies require more recovery and repair time. So with these tears here, like I said before, the only time that our bodies are able, or our bodies are able to repair these is during sleep. Okay, and then this is kind of where diet and nutrition comes into play, because our body requires protein to be able to do these things. So amino acids. So amino acids are considered essential, meaning that our bodies do not produce them. So we have to give that to our bodies. And we do that through protein. Okay, so when I work with my clients that are athletes, I always ask them, what are you doing leading up to bed? Are you doing taking any kind of protein? Are you taking any supplements, vitamins? And so I always recommend that they take in some protein, preferably through like a protein shake, about an hour or so before bed. Nothing later than that, because then you'll be up having to go to the bathroom. So about an hour before bed, take in some protein, because the body breaks the protein down into amino acids, and then the amino acids is actually what aids in the fusion and the repair and regeneration of those muscle tissues and fibers. And so that's how that works. So they fuse back together bigger, harder, and stronger, okay? Because they didn't like the trauma that you caused. So pretty much what these muscles are saying is, you know what, I didn't like this. So then what I'm gonna do is I'm gonna come back bigger, harder, and stronger. So then when you do that again, it won't be as bad. So for example, if you're lifting weights and you're working out, you ever notice how you get sore, right? And well, that's because these tears is what's happened. You cause these tears in your muscle tissues and fibers. All right. And so if you ever notice that the more you start working out and lifting, the easier it gets. Well, that's because, again, those muscle tissues and fibers decided, hey, you know what? What we're going to do is we're going to grow bigger, harder, and stronger. So then when you lift that 225 pounds again, it's not that hard. It's not that traumatic. Okay. And so of course, when you go to the next, once that weight is easier to lift, you go to the next, the next weight, and then you're sore all over again because your muscles and those muscle fibers and tissues, they were not ready or prepared for that. So that's why it's really, really important. Very important. And so here, what I have here is just a few tips for athletes, to enhance their sleep. They're all important, but one of the things is you want to develop a consistent sleep routine, and that's one of the things that I do with my clients is that when I do my consults, I'm more so listening to what they're not doing than what they are doing. And so one of the things I'm listening for is, do you have a pre-bedtime routine? Which is really important because our bodies and our brains recognize those things. Okay, so something as little as or as simple as brushing your teeth, before bed, okay, or taking a shower before bed. Those things matter because our brains recognize those triggers leading up to bed, and so then our bodies will automatically start preparing ourselves for it. So it makes the transition into bed a lot easier. The other thing is learning how to condition your body and your environment for a good night's sleep. Okay, and so conditioning your body, that kind of goes back to the developing a sleep routine. Um, but in terms of environment, what does your sleep environment look like? Is it dark? Okay, is it cool? Room temperature matters. It's recommended that room temperature is about 68 to 69 degrees. Reason is because as our bodies start to prepare for sleep, our body temperature naturally begins to drop. Okay. And then when we go into REM, our body temperature drops to room temperature. It gets that low, which is crazy to me. But it drops to room temperature, and so that's why room temperature is very, very important as it pertains to getting a good night's rest. So with the whole taking a bath, taking a shower thing, sometimes I have clients that wake up in the middle of the night and they can't go back to sleep. And so I advise them to retrace your steps leading up to bed. So redo that pre-bedtime routine again. Now, you can cut it short if you need to. You don't have to do everything. But take another shower. I have clients that have done that. They've taken another bath. Because what happens when you go from that hot water and you step out, you cool off immediately. And so it kind of gives the body a little jump start in getting ready for bed. Other thing is minimize screen time, whether it's a cell phone, laptop, tablet, TV. You want to do these things at least 30 minutes leading up to bed. I know that there's research that has come out that says that doesn't matter, but there's also research that says it does. And so that blue light that's emitted from our screens actually tricks our brain into thinking that it's time to be awake. And that just kind of goes back to the whole conditioning, your body and your environment. It's conditioning your body to not want to look at the screens. I talk to high school athletes all the time, and I ask them like, is it really that big of a deal if you don't have your phone in front of your face for 30 minutes? Like you're not going to miss anything. Your body needs to get that sleep in order to function properly during the day. Another thing people don't realize is that it's said that structural damage actually happens in our brains as we're using them. So as I'm talking right now, as Miriam is listening to all of this, and for those of you that are going to be watching this later on, as you're taking all this information in, structural damage is actually happening. Brain cells are actually breaking down. And so what happens is when we sleep, there's a huge rush of cerebral spinal fluid that comes in, and it cleans and it flushes all those toxins and byproducts out of our brains, out of the spaces in our brains. And so that's how, when we wake up, that's how we have mental clarity and focus during the day, is because all that gunk is washed out and cleaned out. So it's really, 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 really important. Then, of course, do not perform stressful activities in the bedroom. I always get a laugh out of this, but the bedroom should be only used for two things: that is sleep and intimacy, and that is it. Okay. Anything I've got clients before that, and I said this, from the previous slide. that they, because of COVID, I'm doing work at home now. So I do a lot of work in the bedroom, or I'm doing schoolwork if they're in school. I'm doing schoolwork in the bedroom. And so then they're stressed. And so then their body, again, only associates that environment with stress. And then, back to the whole screen time thing. When you're looking at your phone and, Facebook and TikTok and Instagram and all these other crazy apps that we have now, your brain and your body starts to associate that environment with wakefulness and excitement. And we don't want that. We want it to associate with, with relaxation and sleep. And that is really, really important. And so that's what I do with my clients. I really help them get a baseline of what they're not doing, and then of course what they need to do in the future in order to get a good night's rest. And it's not easy. It's not easy. It does take time for your body to acclimate to this, but it matters. I do this for myself. I've got my 12-year-old daughter. I've got her on a sleep plan. She's doing really well, and she's an athlete also. And so it's very, very important for her as she's still growing and developing, into a young adult. So, so that's really important to follow those tips. And there's other things that I do with my clients too, but those are my 4 core, tips for getting a good night's rest. All right. So Miriam, I want to thank you again for allowing me to do this. Again, this is my company, Circadian Health Systems. I have if you want to get a hold of me, there's my phone number, there's my email address, and of course, this will all be available to you, on the website once she posts this. And then these are some of my sources here, some of the information that I got leading up to this presentation. A lot of it I already knew myself, but I did kind of go back and refresh my memory on some topics and some other things. So again, Miriam, audience, thank you very much, and I hope to work with some of you soon.
Thomas, thank you. That was super interesting and educational. I love the fact that you dived into the hormones and the science behind sleep. I thought that was super interesting. And I love also that you're using the word conditioning, because I think that's a word that speaks to every athlete, right? What you do in your training is conditioning. You're conditioning your body for better athleticism, but also for muscle memory, and sleep is no different, right? Getting that routine right and repeating it and conditioning your body to that routine is a form of muscle memory. So I think that speaks very well to a lot of athletes. I did have a few questions for you, and I wanted to ask you first, is there any data that you are aware of on the negative impact of poor sleep or sleep deprivation on athletic performance or the performance of athlete? Is there a link that has been shown, and can you talk to us a little bit about that perhaps?
Oh yeah, there's a lot of research out there that shows it and talks about it. And I'll tell you this too. So Stanford University did a little study with their athletes. And so I think it was their football, tennis, swimming, and baseball. I think basketball too. And so they kind of challenge them and say, hey, increase your sleep time to about 9 to 10 hours. Okay, these are student athletes that we're talking about. And so they did that. And next thing you know, you started to see that their percentages in certain in their respective sports started going up. So for basketball, 3-point percentages went up, free throw percentages went up, injuries were minimized, right? And so with the whole injuries thing, because now since your mind is more clear and more focused, you're more mindful of your movements, and how you're moving, how you're landing, how you're stepping, all these different things. In swimming, and this, swimming, a small fraction of a second matters, in winning. When you touch that wall, so those numbers went down. In tennis, reaction times got better or were increased. Serving power was increased. So it's really, really cool when you have data like that to go off of, that kind of says, hey, you know what, it matters. I have a client that I'm working with now. He's a semi-pro football player, and just 2 weeks in with my program, he feels faster. He's more mentally present in his workouts. And then he's noticing he's actually packing on some more muscle that he's never packed on before, just within 2 weeks. So when you get that kind of data, that personal, data, and then you look at other research that's out there, it's really, really fascinating.
Do you have any sort of device, or like, does it make sense for an athlete to try to monitor how much they're sleeping, the quality of their sleep, or is it just these gadgets are not even reliable, or it's not even useful? Like, what do you think about that?
So I kind of have mixed feelings on the different apps that are out there. Just from where I come from, in the sleep medicine field, I've gotten into plenty of arguments, with patients about, what our sleep data says compared to what their Fitbit or what their Apple Watch says, and of course what we do is a lot more extensive, because we're actually looking at the data. We can see what's going on. We can see their EEG and their brain waves. But then they're like, no, because my watch says. I'm like, no, I don't care what your watch says, But I think there is a place for it, because it really gives people kind of an idea. It gets them involved within their own therapy or within what's happening with their bodies. So I think there's a good place for it. I just think that accuracy sometimes gets lost, because the watch really doesn't know when you're sleeping. It really doesn't. It just goes based off of body movements. So
Right.
of course, during a regular day when you're constantly moving, and then at between 9:30 and 5 o'clock in the morning, you're not moving as much. It's obviously that's a time where you should be sleeping, but it doesn't necessarily know when you're doing it. So I like it, but at the same time, I'm kind of like, I don't know.
I think the other side too is that then when you happen to not get the right amount of sleep, I mean, athletes are so obsessed about things, to be perfect and right in every aspect of their training. And if sleep becomes like that, then I feel that it could bring also more stress than it actually relieves. So it's interesting as a device. Like, I've seen people use it, and I've seen others that were like, no way, that stresses me more than my actual paying actual attention to my sleep.
Yeah. Now I will say real quick, I will say there's a company out there that I have been talking to, and they have this little headset thing you can wear, like a headband, and it actually records real-time EEG when you're sleeping. So I call it sleep mapping. And so I'm actually looking into getting one of those so I can provide that service too. That'll be pretty neat to actually see how they're sleeping, what stages of sleep they're transitioning into, and then also, because REM is really, they're all important, but REM is really important. I'd like to see how many REM cycles they're actually transitioning into. That'd be really neat to see.
Right, absolutely. One other question that I have for you is often there's a mental blockage or stress associated with the inability to sleep. Athletes are like super busy lives, especially if
Yes.
they're a college athlete. They're busy with school, they have to deal with homework, sometimes it's internship plus the training and the competition, and they try to go down at the right time, but they just cannot like settle, and they won't be able to sleep, and their brain's working. And so do you have any recommendation on how to deal with that? Like, how do you turn it off?
Yeah, so that's where the routine comes in, right? So I always recommend a 30 to 45 minute, downtime leading up to going to bed, right? And so within that downtime, that's where the no screen time, I don't care what device you're using, the no screen time, okay? Because once you get caught up in that, again, your brain's like, oh, it's time to be awake, it's time to be excited, oh, that's funny, oh, that's sad, so you're going through all these different roller coaster of emotions as you're scrolling through these news feeds. And of course, if we're talking about professional athletes, they have so many critics outside of themselves, so they're going through their social media, and they're seeing people that are talking about how bad of a game they had and how much they suck as a shooter and all these different things that are going on. And so then that gets to you. So student athlete, professional athlete, develop a routine, a pre-bedtime routine, because that's where your mind and your body is able to relax and to calm down and to de-stress and to defragment and decompress prior to going to bed.
Yeah. And what about for those athletes that I go back to the collegiate athletes because I think
Yes.
that when you're running a dual schedule, during your competitive season, it's really rough. It's really
Yeah.
tough to manage everything. And so, when you don't have, and I hate to say this, but I think it
Hmm.
will happen. Sometimes you got to finish your homework. You got to
Oh yeah.
assignment for next day. So like you're cutting short your night because you got to finish that, right? And often that's where it gets cut. Like it's what gets cut at the end of the day is sleep because you still have to finish this, and this, right?
Yes.
Um, can the night be broken down where you may be taking a nap during the day so that you have a time to sleep enough through that day? Like, is that even an option to have a nap in the night to fill up your needed sleep?
Well, so yes and no. So the reason why I say no is because, here's the thing: if you get 10 people lined up that specialize in sleep, you're going to get 10 different answers. Because everybody has their own little, But the way I was trained is that naps are a big no-no because what we have this thing called a sleep bank. Okay, and so if you nap during the day, you rob, from your sleep bank, or you borrow from your sleep bank for that night. Okay, and so a lot of people get into trouble because they'll take a 2 hour nap, and then by 9:30, 10 o'clock, which is their normal bedtime, they're just laying there, they're staring at the ceiling because they can't sleep. Well, that's because you already borrowed 2 hours, from that sleep bank. So now your body's like, well, hey, we already kind of recharged, so I'm ready to go. And so now it's midnight, 1, 2 o'clock in the morning before they start shutting down, and then they have to get up early, you know.
Yep. I know what you're talking about. It's like dealing with a toddler and having to shorten that afternoon nap so they actually sleep at night.
Yeah, so that's kind of where a lot of student athletes or just collegiate, even just college students in general, that's where they get into trouble because they think, oh, okay, I got to get this nap in, and then they're up all night and then they're tired the next day, and so even though you may be tired during the day, it's good. You gotta kind of push through that so then you can sleep at night.
Yeah.
On the flip side of that coin, naps are good because that is a good recharge, for you to kind of for that mental clarity and that focus for whatever you have to do that second half of the day. So you have to find that balance. I usually recommend, if you're going to nap, I recommend at least 45 minutes to an hour, nothing more than that. Anything more than that, and then that's where you get into trouble at night.
That makes sense. Any recommendation for us on jet lag and, sleeping when you're traveling with your team?
Oh yeah, absolutely. So there's a lot of different things that are out there. Some especially on the professional level. Some teams have coaches that help them determine or help them develop an itinerary before they travel. Especially if you're going from East Coast to West Coast, different time zones. That matters. So what you want to do is that you want to try to, if you know coming up if you're going to meet in a different time zone, you want to start conditioning your body to be able to function within that time zone. Okay. So if I know that I live in New York and I have a game in California, all right, I'm going to start leading up to that. I'm going to start conditioning my body to be able to function during that time zone. So whether I need to stay up longer, and just kind of condition my body to get used to going to sleep later, or if I need to, not so much stay up longer, or even wake up earlier, in order to get used to that time zone. That's really, really important. If you're on a plane, take a nap, go to sleep. It's not going to hurt anything if you take a nap or go to sleep on the plane. But my main recommendation is if you know where you're going to be and you know what the time zone is, calculate what the difference is, and then start conditioning your body, getting used to that before you go there.
Yeah, especially if you're going from the West Coast to the East Coast, these early hours in the morning, it's rough when you have to wake up
Yes.
at 6 or 7 and it's 3 a.m. on the West Coast. That's hard.
Yeah, and that matters when you're playing, and when these professional athletes are traveling. I don't care what sport, football, basketball, soccer. I don't care what it is. That affects you, because you're what's called your circadian clock or your circadian rhythm. That's what governs sleep. Okay, and so if your circadian clock is used to a certain time frame of going to bed and waking up, when you go to a different environment like that, it still wants to operate that way. And so then when you're awake, when it thinks you should be asleep, it's going to start trying to force you to do a hard shutdown, and that's when you hit that what we call circadian dropout, when you start kind of crashing a little bit. That's what your body is doing. It's like, wait a minute, we're normally, either getting ready to sleep or sleeping at this time. Well, that's what we're going to do. And so that's when you hit that wall. Yeah.
Can you touch briefly on sunlight and sleep? You hear often, like, especially when you're traveling, like, try to get as much sunlight as you can during the hours of the day so that you can readjust quicker, perhaps, than you would do otherwise. Is this something you would recommend as well?
Oh, absolutely. So it's really good to, I call it the melatonin faucet. So in our brains, we have this gland called the pineal gland. And the pineal gland, it produces and releases melatonin. So melatonin is the hormone that helps us initiate sleep and kind of helps us sleep throughout the night. So when light is introduced, melatonin turns off. When it gets dark, that melatonin faucet turns back on. So it's recommended that when you wake up in the morning to get up and immediately get some sunlight to turn that melatonin faucet off. Okay, so then your body can start waking up and start being more vibrant and start being more energetic. So that's really important. And then, of course, the vitamin D factor matters, which I will tell you this. I just learned how vitamin D actually works as it pertains to the sun. So it's not so much that the sun, this is how ignorant I was to this. So it's not so much that the sun is providing the vitamin D, it's that we have, like, our bodies activate the production of it. So when the sun hits our bodies start activate that production of vitamin D. So we naturally produce it. The sun activates it. That's what I learned recently from some colleague that I had a Zoom conference with. So that was pretty cool.
Very cool. That's a really nice little insight. I love that. Well, Thomas, you've answered like all of my question, and I thought this was really educational and interesting. And I guess what I remember from this whole presentation now is the importance of consistency, of conditioning your body, and of prioritizing sleep, really. We live in a society where sort of sleep is always put on the back burner because there is so much to do, there is so much activity going on, and we get pulled in all directions. Yes. And really, when you're an athlete, sleep should be one of those pillars of wellness that you prioritize. So I would guess that you agree with that. And just curious if you have one last recommendation for everybody, or one last thing that we should remember when it comes to sleep.
Yes. So my big thing, and I touched on this before, but there's two things. So routine and protein intake for the athletes. Make sure you're taking in protein an hour or so before bed. So because at the end of the day, bodies do not have enough protein in our stores to help break down into amino acids to help with the rebuilding and repair process of our muscles. So make sure you're taking in protein an hour before bed.
Okay, great. Well, on that note, we're going to close up. Thank you so much for your time and sharing that information with us. We're going to put up your webinar as well as your contact information and the link to your website on our website so that everybody can reach out to you and learn a bit more. And once again, you work with athletes individually to help them with their performance, and teams as well. So I encourage everybody to reach out if they're struggling with their sleep and want to improve their performance. And Thomas, thank you again. Have a great day. Thanks.
All right. Thanks, Miriam. You too.
All right. Thank you. Bye.
All right.